Hello everyone and welcome to this episode of Trust TV. I'm your host Memo Hea, and with us we have Dr. John Willardsen. Thank you for being here.
Thanks Memo, thanks for having me.
And in today's episode we're going to dive straight into it. We're going to be talking about credentials. Now Dr. Willardsen, you and I have talked about this quite a bit. We see weekend courses that these doctors are attending in order for them to start placing implants. Now my question is, can these doctors really do the surgical phase and the prosthesis phase by simply taking a weekend course?
Yeah. So, you can get some pretty basic, kind of scratch the surface understanding of implant surgery and even implant prosthodontics. But there's simply no way that you could take even some of these maxi courses, the long courses that are multiple weekends or a year long every weekend. It's tough to get, it'll get you started, but it really is not enough to have the confidence to really take a case to fit to the finish line, Training is really important. Your credentials, your background, your training is key. And in most patients, oftentimes they're dictated by the price. They want to go to the person who has the cheapest price and not really know their background or their training. And so, I would say that's probably not the best way. I would want to know the credentials of the doctor that I'm working with and see some of their work and know that I'm in good hands. And so credentials are very important. I feel like the credentials that I have are the best that you can get, and the cases that I do, it's all about ethics. It's how ethical are you, and how ethical are you, even in the quiet of when you're placing a implant, or if it's an implant that's a cheaper brand of implant or a cheaper type of bone or brand of bone. Only the doctor knows that. Even his assistant doesn't really know the quality of the materials that he's using. They're just kind of using whatever he's using. So it really kind of goes to the core, and it's a question of the ethics of the doctor. And so credentials are very important, because if you have credentials, you have ethics, because you've been trained and you've studied. You read the literature, you stay on top of what's going on in the industry. And so whereas if you took a weekend course, you're not really diving into the literature, or you're not surrounding yourself with people that are basically the grandfathers of the industry. So okay, it's very important.
So if someone wanted to get just a single implant, maybe they could go to these doctors, right? Because a weekend course will teach you how to place an implant.
Exactly. Implant surgery, we used to say, a monkey can place an implant. But when you start getting into the details of doing a case, a robot or a monkey cannot do that. There's so much intricacy and detail that goes into every single case that, placing one implant, you could probably get away with it. But doing a full arch case, doing multiple, and then having many full arch cases, that is a little more than what a doctor who's just taken weekend classes could handle.
Yeah. So let's talk about your credentials, or the credentials that someone that's like you that could be fit to actually do a full mouth reconstruction. What are those? Like, what type of training did you have to do, or doctors have to do in order to have your same credentials to be able to do the same type of cases that you've been doing for the last 20 years?
Yeah, I'm kind of an anomaly. My training is through Loma Linda University implant prosthodontics training. It's a 4-year program. It's, and they cover everything. If you can imagine immersing yourself in implant surgery and prosthodontics for, 4 years, you're going to get a very well bona fide training from a bona fide university. Loma Linda's the best in the country, I would say. But outside of that, any, oral surgeons get good training for implant surgery, but they get no prosthodontic training. prosthodontists get some decent implant pros training or implant prosthodontics training, but they don't get any surgical training. And that's the issue, is the two are dissected. They're not, you know, if you end up in a surgical practice, you're going to end up in another practice to have the prosthesis made or the teeth made or whatever. And the surgery, I can't separate the surgical phase from the prosthetic phase. They're intimately tied together. So, you know, there are dual degree, dual trained doctors out there that do both surgery and pros. But it's more of a rarity than it is a commonplace. You know, in the marketplace, it's more you have a surgeon placing the implant, and then you have a prosthodontist doing the teeth or the crowns.
Yeah, wow. To me, that makes perfect sense. I would want someone who knows how to do both, because you're placing the implants and you know how the prosthesis is going to go on top. So I mean, I've never done the type of work that you're doing, but you have to kind of measure how everything goes in, right? And since you do everything in-house, you can, the finals are that much better than if someone who goes with the...
I've controlled the process. I have control of the process. I can't, if something isn't going right, I can only blame myself. I can't point the finger at the surgeon, oh, well, he didn't place the implants in the right position, so now I have to compromise on something. So from the very beginning, and I talk about this in my videos, from the moment I meet the patient and treatment plan their case to the day that I deliver their final set of teeth, I mean, I have meticulously planned every single step throughout that process. So if there were multiple doctors involved, somewhere in that process, something could get broken. You know, the system or the process to get the patient to the end, you know, to the finish line could possibly be broken, you know. And so usually not, but I would just say if a patient or a person is looking to have their mouth reconstructed, you know, make sure you do background, you know, understand where the doctor was trained, that they've got bona fide university-based training, whether it's in oral surgery, prosthodontics, implant pros, you know, just so that you're in good hands. And they're using they have high ethics, high quality materials, and in the end, you know that you'll be able to, the investment that you're making in your mouth will be secure.
Perfect. So how do people do this? How can they check this with the practice or doctors?
That's a great question, and it's tough because, you know, it's not like the doctors are putting their diplomas on the internet, you know, but any trained oral surgeon, trained prosthodontist, you know, you'll know whether or not they have those sort of credentials. So,
well, credentials, and in your case, you have the credentials plus the experience.
Experience is very important.
Over 20 years in the business, right? And thousands and thousands of successful cases. It's pretty safe to say that, you know, it's a good bet. So, well, that is it for today. Thank you, everyone, for watching this video. And thank you, Dr. Willardsen, for being here and answering those questions for us and being transparent. If you like this video, make sure you hit that like button. You subscribe to our channel. We're producing new content all the time. And if you have any questions or any comments, make sure you leave that in the comments section. And again, thanks for watching Trust TV.